Because you're facing. So when you're putting on the pads, you want to make sure you put on the pads so they will cross their heart. Now, me, for instance, this is my left side. I'll put a pad right here, and I'll put a pad right here because I want the electricity to cross my heart. Okay. If you have a child and you have only an adult pad, an 8-year-old, so to speak, 8, 9, 10-year-old, you can put the pad in the middle of the okay. So for this patient, I'm sorry, person, put the pad right here, put the pad right here. It doesn't, it just has a diagram.
Oh, it doesn't matter now.
Yeah, because it doesn't matter which pad you put on as long as you place it, yeah. So you hook everything up. First you turn on the AED, it tells you to apply the pads.
Analyzing heart
Now you're
rhythm.
still doing CPR.
Oh.
You do not stop
Do not touch the patient.
until it tells you not to.
Shock advised.
Now once it tells you shock is advised, tell
Charging.
everybody to stand clear.
Yeah.
Stay clear of patient. Deliver shock now. Press
Press the
shock
shock button.
delivered.
Oh,
Begin
And
CPR.
go ahead and start your CPR. Okay. So you do not interrupt CPR while getting the AED is still starting. You don't interrupt CPR at all.
oh, you keep on,
You still continue.
Oh, really?
Yes. So if there's 2 people, say, y'all look here. You say, I'm gonna start CPR, you go get the AED. He started his CPR,
Yeah.
he's done his 5 cycles, you should already have that come back with the AED, if it's close, and have the pads applied. Then, once it says shock advised, and he's done with his 5 cycles, you can switch roles.
So after the shock advice, we do CPR.
Yeah, you still do, after it says shock advised.
Turn off the.
No, you don't turn, I just turn it off because it keeps beeping.
Oh, okay.
No, it keeps going. It keeps going until the paramedics come.
Oh, okay.
Yeah. Yes, it actually, my very first cold, the adrenaline was pumping. So I wasn't as tired at first, but afterwards I was drained.
Yeah.
I was way too tired. So yeah, so pretty much I'll go over the scenario again. And I'm gonna act like it's 2 of you, okay? I see somebody pass out. Hey, are you okay? Check the pulse. I'll go ahead and start my CPR. I'm telling you, hey, go get the AED. I'm still doing my compressions, 32-second break, as if the breath. Keep going. You come along with the AED. We turn the AED on. I'm still doing my compressions. He's applying the pads.
Analyzing heart rhythm.
The pads is analyzing heart rhythm. I keep
Do
going
not touch the patient.
until it tells me to stop.
Shock advised. Charging. Stay clear of patient. Deliver shock now. Press shock delivered. Begin
I
CPR.
keep going. Okay. I keep going until the paramedics show up. Okay. Now, we've had this happen before. If a patient wakes up and says, ouch, you stop. Okay? You turn them over to their left side, which is what left side, which is called the recovery side. Okay? Any questions?
How come?
Because, well, actually the heart's on the left side of the body, so that's why they said that's the recovery side. Yeah. Want to try it? Yeah. I can scoot it over there to you.
Oh,
So you know,
okay.
yeah. Mhm.
You have this structure.
Okay, so right now I'm just gonna check you off on compressions. okay? So each side. So what you wanna do, usually you're gonna be on the floor, you're not gonna be on
Yeah.
the table,
Yeah,
okay?
I know.
So if you wanna get on the floor where it's more comfortable, you can, or I'm a little bit taller than you, so it's easier for me to kind of go over. Yeah, you're gonna have a little bit, you wanna get on the, yeah.
We need,
Okay.
Hey, are you okay?
No pulse,
No
okay.
pulse, and then
Go ahead and start your CPR.
this is
Now,
nice
you
one.
want, your landmark has to be between
Yeah,
the
between.
two nipples.
Yeah,
So your
here, here.
nipples, yeah, your nipples are gonna kind of be right here, so you kind of want to be over here in this little spot. Okay, so here's my little suggestion to you.
What?
Get closer.
Oh, close.
Yeah, because it's gonna help you.
Oh, okay.
There you go.
The right side is strongest, right?
Whichever side you're dominant. So if your left hand, go with your left hand. If your right hand, go with your right hand. Oh, you're gonna hurt yourself.
One,
Okay, I'm gonna show you something. Okay. So with me, I kind of give myself, I kind of do this. There you go. I lean over,
Okay.
okay, and I use the weight of my shoulders and my biceps to push down. So you don't want to be like this, and you definitely don't want to lock your elbows. But you kind of want to, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. So it's really like,
Oh, okay.
you're really pushing down, okay? All right, there you go. There you go.
okay. 1, 2,
3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 22, 23, 24, 25, 26, 27, 28, 29, 30. There you go.
1.
Hard, isn't it?
Yeah. And then?
Yeah.
And then you go again. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
1,
2. Now you see how hard it is? And you're just on your third one.
1, 2, 3, 4, 5, 6,
7, 8, 9,
30.
30.
Uh-huh.
1, 2, 4, 3, 4,
5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 23, 24, 25, 26, 27, 28, 29, 30. All right, last round.
1, 2,
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. All right. Yes.
Yes, yes, yes.
Yeah, that's quadriceps, arms, and shoulders.
Okay, but the neck is here.
Yeah. You okay?
It's your turn.
Okay, ready?
Yeah.
All right.
Hey, are you okay?
Oh, okay. So the carotid is in the neck. So you want to go a little bit down. There you go.
Okay.
All right. So no pulse.
Yeah.
No pulse. All right. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 23, 24, 25, 26, 27, 28, 29, 30.
1, 2.
2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 17. Okay, one last round. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Awesome.
Oh, okay.
All right, so
Get it.
I'm going to
You've been
receive,
fighting hard.
and then I'm gonna be the one that comes with, y'all, one of y'all is gonna be the ones that come with the AED.
Okay,
Okay?
get the EAD and put it up there.
So I'm gonna go ahead and do CPR.
Okay?
All right. So, hey, are you okay? No responses. Check for a pulse. You go get the AED. So I start chest compression. Okay, first thing you wanna do is turn it on.
Analyzing heart rhythm. Do not touch the patient.
No, you don't. You plug it, yeah, but we will not plug it now.
Shock advised.
You get the plug, right?
Yes, but I mean,
Okay. Sorry.
Stay clear of patient.
okay, all clear, so whenever, whoever's in
Deliver
the.
shock now. Press the orange button. Shock delivered.
Okay,
Begin CPR.
so I'll keep going, okay, until it tells me. And then it'll just repeat
So
itself.
it will just stay this here.
It just stay right here because it actually sticks on the paper.
Oh, okay.
Okay. Now, there's two things I do want to remind you about. If you have somebody, a man with a hairy chest, and there's two different pads in there, and there's no razor in the AED pad, go ahead, take the pad on and give him a wax. Yeah, just give them a nice little wax, okay?
Oh my, yeah, they will not complain.
They won't complain, they won't know
You
anyway.
loaded the part loader, huh?
Now too, if anybody, has been in water, and they're unresponsive, meaning like they're almost drowning, something like that, pull them out of the water, but make sure you protect their cervical spine, their neck. Cause you don't know if they hit their head before they got into the water.
Okay.
The second thing you wanna do is get a garment or a towel. Now, if they're by a pool or something like that, it should have a towel, but you wanna dry them off before you put on the AEDs, cause what's gonna happen, you're gonna burn.
Yeah, okay.
And you don't want them to burn. If the shock would just go on the skin and they'll have a real big bad or, yes. So make sure you wipe them down.
Oh, okay.
Okay.
Yeah.
Still use them on pregnant women. Pregnant women still use AEDs.
Yeah.
You still do CPR the same, it's not gonna harm the baby,
Yeah.
okay?
Yeah.
Any questions?
All kinds of situation, as long as you know that it's not responding anymore.
CPR won't harm the baby when pregnant?
No,
Yeah,
no.
It's here. The baby's
Yeah,
here.
baby's here, baby's protected by a whole nother organ, the
Yeah.
uterus. Yeah, so baby's
And you
fine.
have to, the baby should breathe as well.
Right, so we definitely want baby with the oxygen.
Yeah.
So yeah, pregnant women, same thing. Hairy man, just make sure you, or woman, give them a good wax. If they've been in water, you wanna make sure that you wipe them down, okay? Any questions?
Okay.
We're good? Okay. Sorry, y'all, I got a bad knee. I got a Baker's cyst on my knee. Yeah. All right, so we ready to go to baby?
Yeah.
All right. Babies, bless their heart.
Yeah, I know.
This happened to me in the hospital, it's really. Babies.
Are you a nurse?
Yes, I'm a nurse, yes ma'am.
Yeah.
Well, the good thing, babies do not need this. They don't need it. If they have any type of heart problems, then they were born with it. Okay? Probably some type of chromosome defect or something. Yeah, babies don't need it.
Crying is good for babies.
Huh?
Crying.
Yes, when they're crying, that means they're responsive. If they're not crying, not smiling, not eye contact, but sometimes their eyes will roll
Yeah.
away, that's when you definitely need to do CPR.
Okay.
Okay. Babies are a little bit different, they go down fast, so you definitely have to be paying attention. Way to get to see if a baby or toddler is unresponsive. You want to tap it at the bottom of the hip. Please do not do this. Okay? Shaken baby syndrome. We don't want that, because now you got a whole nother set of problems.
Oh, yeah.
Okay? So, they're not responding, don't spend too much time on this because you're not a medical professional.
Yeah.
So you're probably not gonna be able to feel the pulse, but we call it brachial. And it's gonna be in the baby's arm, okay?
How come it's not there?
It is there. It is there,
But
But they
they
have-
have those
they're
short
like this, and they're so flat, and it's so fat,
Yeah,
right there, you're not gonna be able to.
yeah.
Okay, so you will feel it in the brachial pulse. Now, unresponsive, no pulse, you go ahead and start CPR. Okay, now, the American Heart Association, well, it's actually more up here. Yeah, but you can't, it's funny, you can't
Oh, yeah,
really
it's
feel it
here,
up
it's
here,
here.
yeah,
It's here.
it's harder, but yeah. So, you definitely do, what was I gonna say? The American Heart Association recommends the encircling thumb technique.
Yeah.
They say it's better. They don't recommend this anymore
Oh.
because they're saying that it's not as strong as your two thumbs. In the hospital, we have different ratios for the baby. I can tell you, but that's not gonna be important. The only thing that I can tell you is just continue to do chest compressions until the paramedics arrive. Okay? Or until the baby starts crying really bad. So it's half of the depth, 1.5 depth of the chest. So you're 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay? Now, it's 2 of you. How we do it in the hospital is 15.
It's only 15.
It's only 15 if it's 2 people. But if it's 1 person, it's 30. They still don't recommend the breast for the baby. They're saying they're not effective. Okay. So, yeah, I'm having memories of that day. I'm sorry. But, yeah, so you just want to do chest compression. You want to have depth of the chest. The rate is still the same on the adult. So you still kind of do it 100 to 120, and it's still the 5 times 2. Okay. Trying to see everything. Same thing, recovery side as well.
Call, bring me here. One,
Yes, like that.
1, 2, 3, 4.
Uh-huh. Yeah, so right in between, imagine the nipple, if it's her closed, the nipple line, and you go right in the middle.
1, 2, 3, 4, 5, 6. Oh, it's there. It's big.
Yeah, it's bigger there in babies than it is in adults.
Are you okay? Yeah, I thought I cannot hold the baby with this and then.
You can,
Yeah,
Yeah.
exactly.
So
Look
it-
at that.
So it's a little, I wanna say, they're a little bit easier than adults as far as doing the compression. But, yeah, it's still scary.
1 inch and a half for the babies. The adult is 2.
It's 2. Well, or 2 inches or 5 centimeters.
Yeah.
And baby is 1.5. Yeah. Just make sure, I always wanna say, go down enough to make sure that you think that you're pumping your heart. That's just my suggestion.
Okay.
Okay. So, because you won't have anybody who can monitor you like we may have people monitoring us at the hospital. So just make sure that you go down enough for you to be able to. Okay. So your form was good on baby. You want to try yours? Okay. Uh-huh. There you go.
Oh, you
Yeah.
first and then you do that.
How many times?
It doesn't matter.
Don't stay
If
there
they-
longer.
Right. As soon as you
And
find
then
out
you do this one here. Pulse.
now never check a pulse with your thumb,
Yeah.
because you have a pulse in your thumb. Mm-hmm. Or you can do this.
You do like this one. Oh.
Go inside. Well,
No.
Mesh.
no, go the other way. There you go. Yeah.
Okay.
Uh-huh. And it's one.
That's
One
good.
and a half?
One, keep go down, you gotta go a little bit deeper. Two, there you go, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 13, 14, 15, 16, 17, 18, 29, 30. There you go.
1, 2,
So 5 cycles for each.
5 cycles, same as the other.
I heard you 15. What was
If
that?
it's 2 people, it's in the
yeah,
hospital. 2 people, it's 15 and 2.
Okay.
Yeah, right there. That's how you check the brachial pulse.
Yeah, okay, so that's it.
Mm-hmm.
This is.
No.
I'm going to work.
This is,
Okay, so, any questions on the baby?
that's.
So that's just the grab back.
That's just the CPR.
But the same thing, while I'm doing the CPR, call the,
Yes.
yeah, somebody will call
So
the,
if you're alone, then you're on first.
If you're alone, call first. You put them on speakerphone and they can actually walk you through it because you might be a little bit kind of scared,
Yeah.
so to speak, so they'll walk you through it. Any questions? Okay, so let's go to choking.
Sure.
So since we're on the baby,
yeah.
now with babies, they don't have that classic sign of choking unless they may be a toddler.
Uh-huh.
Okay, but the classic sign of choking is this. Another way to find out if a baby is choking is they're drooling a lot, tongue is sticking out, or they're making the gasping sound like that, okay? Now, when you're, I like doing this sitting down because you have more support. Okay. And I always use my legs and my forearm, okay? So when they're choking, you want 5 back thrusts and 5 chest thrusts. You keep doing it until baby becomes responsive or unresponsive, and then you have to start CPR, or until the object, you see the object come out, okay? So I call this the EC. This is my C, my pointing finger, my thumb, and my E is supporting their neck.
Okay.
1, 2, 3, 4, 5. Now make sure they use somewhat tilted down. EC, support their head,
Yeah.
support the neck. 1, 2, 3, 4, 5. I keep doing it until either the baby's not responding anymore or the object comes out. Now, if the baby's not responding anymore, I immediately go ahead and start CPR. Now, if you see the object in the mouth,
Yeah.
you can go ahead and take it out. If you don't see it, they don't recommend you stick your finger in
Yeah,
the baby's
because
mouth.
in morning they will.
Same with the adults. Okay, so we'll go to the adults. But I just want to let you know the same thing, that if you see it, take it out. If you don't, don't. Okay? Once they come unresponsive, I know you're not supposed to interrupt, but go ahead and get your cell phone and put it on speaker and listen. Okay?
5 times, yeah.
Yep.
Back and front.
1, 2, 3. It doesn't matter how you start.
But after the back, you put the,
Front, I just tilt baby over.
yeah, tell them.
Just keep
How strong?
until, to be honest with you, kind of hard. You want it to come out. You want them to live. So if it's hard, it's hard. I know being daycare workers is gonna be kind of hard. Y'all, because the baby might have a little bit of a bruise. But just let them know that baby did choke on an object and you have to do this. Okay? So you kind of want to do it. All right.
Are we delicate already?
Yeah, you said, yeah. So go ahead, try. We're almost done. There you go. That's good. And kind of tilt baby down.
There you go.
There you go. Yep.
You're killing the baby.
Kind of tilt baby.
Tell the baby.
Right. He does it a little bit different than me, but that's okay. As
Yeah.
long as he's tilting the baby and doing the chest
Look at the
thrust.
mouth. Look at the mouth.
You see it? Okay, there you go. It's out.
Board.
Actually, put it on the same leg. So you're using your left arm, use your left leg. And kind of have the legs in between your arms. There you go. And then turn baby over. No, never switch your hands because it's gonna Yeah. If you're gonna do it that way. Okay. All right.
Like that?
So, yeah, okay, so you have it like this. So you see how I'm doing my right arm, right leg? I got baby tilted down. If it's a little bit of a heavy baby, of course, you're gonna be sitting down. 1, 2, 3, 4, 5. You see how I switched over to the left?
Oh,
1, 2, 3. Now, he did it differently, but that's okay. But if you're going to do it this way, make it easier on yourself to kind of switch baby back and forth. Okay?
Don't chop the baby.
No, okay, yeah, you did it right. Switch up. There you go.
1, 2, 3, 4, 5. So tell them, then look at the mouth. You okay?
Got it up. All right. All right, for an adult choking, you want to do the Heimlich. When we were kids, we used to call this frogging.
Yeah.
We used to kind of go to each other and kind of frog. I don't know why we did that. That's just, but you kind of do it the same way. So you want to kind of make sure your thumb is like this, and you want to push up along the diaphragm. So you want to kind of get right up in here, okay? And you want to push up. So how are you going to push up?
Yeah.
1, 2, you keep going, okay? You just keep going. You keep going until the object comes out, or if he collapses or she collapses, you gently let him down, check for a pulse, no pulse, start CPR. If you see the object, take it out. If you don't, do not do a blind sweep. That's what we call it, a blind sweep.
Okay.
People have had seizures and cut people's, and actually bit fingers off. So that's the reason why we say no blind sweeps.
Yeah.
So any questions on that?
So if
Stand up,
it's,
stand up.
if it's big,
Stand up.
hard, huh?
Now, see, if they're big, what you can do is kind of.
I'm full.
Yeah.
It's here, right?
Yeah, it's there. Now push
Like
up.
this? Oh yeah, this one, right?
Push up.
Put your hands down, you're choking. You're choking.
Bonog spot. Oh my goodness. You will be in trouble.
I love it. Now, if they're a bigger person, you can kind of push them up against the wall
Oh, yeah, okay.
and then push up that way. So it's kind of like,
I'll let them sit, right?
you can let them sit or let them stand and you push up. Okay.
Yeah.
And sometimes they may be too big for that. You might have to lie them down. I know they're already choking and it's kind of like, why would you lie them down? But if you press on their chest while they're lying down, it can actually come up.
Oh, okay.
Okay. So any questions about that?
Yeah, usually it's choking in the thing, in the problem, right?
Yeah, usually.
First aid. Here, so we start with first aid.
Yes, alright. So, my first aid is different. You know about bleeding. Just make sure you have some type of tourniquet. So if somebody's bleeding somewhere, you can use your clothes, okay? Wrap it up, tourniquet, okay? Because what you want to do is compress the bleeding because you want them to start flying, okay? If somebody has an allergy breaking out in the hives, so to speak, do you carry Benadryl here?
Yeah, we have some Benadryl, yeah.
Okay, okay. That's the first thing you want to do is give somebody Benadryl. But if they get to the point where they're like, we call that stridor. Their airway is closing and they're having what we call anaphylactic shock. Hurry up and call 911. Okay. Now, if you have an adult, I'm pretty sure you won't have a baby with the EpiPen. But if you have a baby with the EpiPen is what we call epinephrine.
It's for allergy, right?
For allergies, severe allergies. Now this is where they're breaking out in the hives, they're swelling, you hear the stridor, the airway is closing. They're not gonna care. But there's an EpiPen about, it's not this long, but the whole syringe is about this long. You open it up and where you wanna give it is in the thigh. Okay. Put it in, compress it. Okay. They're not gonna be worried about how bad it hurts later, I promise you.
Okay.
Okay. Do you have oxygen here?
We don't know.
Okay, so I'm not gonna too much worry about that.
Yeah.
Okay. Is there anything else that I'm missing? Cause I'm thinking hospital world, so you have to,
Bites, how about bites?
okay. Bites,
Insect bites?
Insect bites. Yeah.
insect bites,
Yeah, because a lot of,
do you,
Yeah, no.
have anything like witch hazel or alcohol?
Oh, just alcohol, right?
Just alcohol?
Yeah, just.
Yeah, you can have alcohol, put some alcohol on it, do y'all carry Benadryl cream?
Mm-hmm.
Okay, and Benadryl cream, okay. Now, at any time that there's a break in the skin,
Yeah.
whether they scratch or they ran into something and something is open, you definitely wanna clean it off with lukewarm water in the sink, okay? And you definitely wanna put like some Neosporin and cover it up,
Yeah.
okay, because you don't want them to increase in
We have
any
it
type
in
of
the first
infection.
aid.
In the first aid,
Yeah.
Also, any adult or child complaining of chest pain, okay, and they start sweating, go ahead and call 911. If it's an adult, you can go ahead and give aspirin. Bayer aspirin or a form of aspirin should be in your first aid kit.
Oh, aspirin.
Mm-hmm.
I don't know if we have that.
so you
Yeah, we have-
don't need
what's-
prescription aspirin, right?
No, you don't need a prescription for aspirin.
How many milligrams was that?
It's an 81 milligram aspirin. Now, if you do have a 325 milligram aspirin, this is for adult only,
Uh-huh.
then yes, you can by all means get it.
Breathing and sweating.
Yes, they have
Hard breathing.
labor breathing, they're complaining of chest pain. They'll say, oh, I feel like something is sitting on my chest and my chest, is really hurting. And we call it diaphoretic or sweating. That's a sign of, a heart attack or some type of, we call it angina chest pain.
I remember when coronavirus starts and we are wearing that mask, I could hardly breathe. It's like you lack oxygen. So, there's so many who are out just oh, I said, I'm sweating, I could hardly breathe.
Well, you know what, they need to kind of separate from everybody. Take their mask off, take a deep breath, and then put their mask back on, okay?
Okay.
Or they just need to get to a place where they don't need to be around people, yeah, just get some fresh air, to be honest with you.
Yeah. Because I'm on Amazon. We're this
Oh,
person.
my boyfriend works at Amazon, I know exactly what you're talking about.
You could hardly breathe because of the thing, and then they will go around and watch if you're
wearing your mask.
Yeah. Oh my goodness, it's
He told me, he said he couldn't stand it. He doesn't like it. He works in the one, Fort Worth.
yeah,
Fort Worth, yeah.
yeah.
So, yeah. So, chest pain, sweating, labor breathing,
Oh, okay.
then you definitely want to give them aspirin. Most first aids have the 81 milligrams, but if you have the 325, go ahead.
For the kids, it's what?
No
No
aspirin
kids,
for
no
kids,
kids.
no, just adults. Just adults.
Okay.
Okay, even 8 years old,
Yeah.
if they're complaining of chest pain, they could have a heart attack. They've had kids have heart attacks at 8 years old, but don't give them aspirin. Yeah, just go ahead and call the paramedics.
Yeah. So if you're sweating and have a hard time breathing because we fight, you're gonna get suffering. You will do better.
Oh, goodness.
That's very no risky.
Yes, spirit.
And then the last thing,
Burn.
burns, yes. Do you have Vaseline?
Yeah.
Okay. There's different types of burns. There's first degree, second degree, third degree is really bad.
Oh, yeah.
Yeah.
Okay, but first and second degree burns hurt worse than third degree burns. Third degree burns mess up your nerves, so you don't feel anything. It's still an emergency. You still need to call. Okay. First and second degree. First degree burns, just say you have some hot water on the stove or something like that. It gets on your hand and you have a blister. Okay.
Yeah.
First degree burn. Second degree burn, you don't have a blister, but you have a break in the skin, a opening. That's a second degree burn.
Oh, okay.
Third degree burn, you done went through the top layer, the second layer, and the third layer of skin. Okay. If it's just a first degree burn with the blister, just make sure you kind of run the, hand over just in cool water,
Yeah.
so to speak. Do not pop the blister, leave the blister alone.
Mhm.
For kids, I know that's a hard thing to do, you don't wanna cover it. Okay, I'm saying with the Band-Aid, like if it's somewhere here, closed is fine, but do not directly cover it with the Band-Aid. If it's a 2nd-degree burn, do not put any water on it, put some Neosporin, cause any type of water is gonna burn it. It's gonna cause it even more pain.
2nd degree.
2nd-degree,
Yeah, because it is 2nd degree, the
it's
skin
the
is off.
nerve, the skin is off, and
The
then
skin
you're
is
right
off.
there at the nerve pain. So you don't wanna put anything else on it other than Neosporin here. Or if they have any burn cream in the first aid, that's fine, call the parents and see if you can schedule a
Vaseline,
doctor. Huh?
You
Vaseline?
don't put
You
Vaseline.
can put Vaseline on
on
it.
the second-
Yeah, so Neosporin and Vaseline.
Ah,
Yeah, because the Neosporin would help decrease any type of infection.
Yeah.
And then you wanna put the Vaseline over to kind of coat it a little bit. But if they do have burn cream in the AED kit, you can definitely put some burn cream on it.
Yeah, I think,
Not all of them have it.
Others will say pop,
But I
slice the
have a big
tomato
one.
and put tomato.
I heard cucumber too.
Cucumber.
yeah,
I heard cucumber too.
Tomato, cucumber.
Mhm.
yeah, the cold one.
Just slice it up.
Yeah. See, first, 2nd, but the 3rd degree.
3rd-degree call.
That's-
Yeah, that's a real bad burn. That definitely needs medical attention. Definitely need medical. If you have any gauze in there, you definitely don't want to cover it up because what's gonna happen, the gauze is gonna stick to the skin. The skin is gonna hurt it's gonna hurt when it comes off. Yeah, 3rd-degree just automatically call. And then y'all know about stop, drop, and roll. You got a fire extinguisher,
Yeah.
pull, aim, squeeze, sweep everything up. Yeah, okay. And we also call it race if there's a fire, you rescue alarm, which you'll call 911, contain everything, and then get the extinguisher, extinguish everything.
Yeah.
What else?
What?
Stroke.
The stroke.
Okay, so, an adult.
What's the difference between heart attack and stroke?
So heart attack means, okay, so there's heart attack and cardiac arrest.
Yeah.
Okay, so heart attack is when you don't have enough blood flow to the heart and part of the heart tissue dies. Okay, so sometimes that's because of plaque or what we call high cholesterol, and you got a whole bunch of plaque in your arteries. Then you have cardiac arrest where there's an electrical problem of the heart. So there's a little node called the SA node and the AV node. The SA node sends electrical activity to the heart for the top half of the heart to pump, and then the AV node sends electrical communication to the bottom half of the heart so it can pump. Okay, so that's cardiac arrest and heart attack. Stroke is very similar to a heart attack. Okay, you can have what we call plaque in the blood vessels of the brain. We call it a fat embolus. That can cause a stroke, or it can be hemorrhagic, or it can be bleeding.
That's what they
Or
call
blood
it,
clot.
aneurysm.
Aneurysm, there you go.
That's very.
Now, when it bursts, aneurysm.
Aneurysm.
Yeah. Yeah. So pretty much a stroke means that there's a lack of oxygen either on the left side or the right side of the brain. If it's on the left side of the brain, the right side is going to be affected. If it's on the right side of the brain, the left side is going to be affected.
Also, that's why you can see the stroke one.
They're
patient
asymmetric.
Yeah, they
Mhm.
cannot move one either or left or right body.
Uh-huh.
Face left or right face, and that's it.
So we have an acronym for it. So we'll say face, which is asymmetrical or drooping. Okay. Their speech,
Yeah.
they mumble. They
Yeah.
can't make full sentences.
Yeah.
Whichever side is affected, they're either gonna do this
Yeah,
or this. Okay.
yeah.
So look at the face, see if it's drooping, check their speech. If they're mumbling, ask them to hold their arms out. Immediately 911.
Yeah, that's stroke.
That's stroke. The paramedics need to come and give them what we call, I know y'all don't need to know this, but they need to give them some medication to keep it from clotting. Now, if it's a blood, like a hemorrhagic stroke, meaning they're bleeding in the brain, they probably won't be able to do all of this. They're probably gonna pass out.
Yeah.
That one is scary, but if it's just a blood clot or a fat embolism or cholesterol or plaque or whatever the case may be, then they can be able to do this, they'll still be able to respond. They still need the same medical attention, but hemorrhagic is definitely, it's scary, they pass out quicker.
Yeah, they're the same level of urgency when it comes to the stroke and the heart.
In the heart attack.
Attack or different.
How about the diabetic? How about the diabetic person?
Diabetic person, now there's two different types of diabetes. There's type 1 and then there's type 2. If they're type 1, they are born with it. They should already have insulin on them.
Oh, that's
Okay.
type 1.
Type 1 means that they were born with this condition where the pancreas does not produce enough insulin. Okay, so their blood sugar can spike all the way up, or the blood sugar can go all the way down.
Okay.
Okay, if they get jittery, blurred vision, can't speak, hypoglycemia. Okay, they need to eat some candy. If they're, I want to say, very lethargic and they're sweating, that is hyperglycemia. They need to check their blood sugar. Either way, they need to check their blood sugar. But if their blood sugar is high, they need to take insulin.
Oh,
They should already, most type 1 diabetics now have a implanted thing to check their blood sugar, and they have an insulin pump on them.
oh.
Okay, but if you notice somebody here that says, hey, I do have diabetes, now this could be somebody that is type 2, and they're jittery, blurred vision, or whatever, then you need to give them some candy. But always check their blood sugar first. They should already have it on them.
I think that
Okay. Good, sometimes baby. So,
yeah.
yeah, or either just say, I can't accept the baby, because if you don't have all the
Let's prepare her lollipop.
No, we have a doctor's approval.
Oh, good,
Yeah,
okay,
we
good.
are complete in,
Oh, that's nice.
yeah.
Okay.
We are asking them that their doctor will give us communication that they are already there.
Okay.
How about one more? If they fall, like broken.
Broken arm.
Yeah.
Now,
First aid.
Thank you. You're welcome.
all right, so broken arm. Now, there's differences between a complete fracture, incomplete fracture, hairline fracture, whatever the case may be. I'm not gonna go all over,
Yeah.
over those, but what you wanna do is make sure that you contain it really well. So just like you would do for bleeding, you will make sure that you put a tourniquet around that. Yeah, and make sure that you keep it immobile. So just say if it's the shoulders, okay? Just make sure that you kind of get a shirt, put it around the head, and just wrap it around, okay? I would go ahead and just call the doctor if, you know, they're like, oh, I'm okay. But if they're in excruciating pain, if you see any blood, or either change